Welcome to WSIC Dashboard Flu Vaccination Demonstration video. It is more important than ever that we have effective plans in place for this year's flu season to protect those at risk, prevent ill health and minimise further impact on the NHS and social care. As a response to the current situation, the Flu Dashboard was created to support planning and delivery of the 2020 flu vaccination programme. This operational tool visualises the number of patients receiving the flu vaccination within North West London, those eligible and the current percentage vaccinated. Critically, it provides a view on the number of specific demographics, as the flu has a higher impact on vulnerable groups. The Flu Dashboard is a simple, practical tool for primary care and CCGs to track the progress of the flu vaccinations, including the actual uptake rates over a period of time in comparison to last year's uptake. The dashboard will be looking at SNOMED codes coming from the GP clinical system to see if individuals have had a vaccination during this year's flu season. For more information relating to the SNOMED codes used and logic behind each cohort, please refer to the calculated definition section of the Flu Vaccination User Guide. The dashboard will be refreshed weekly with daily GP vaccination data feeds, as well as community pharmacy vaccinations coded into the GP clinical system. The refresh date and the latest data date can be found on the top right-hand side of the dashboard. This dashboard shows the number of patients eligible for the vaccine, those vaccinated, as well as the contraindications and refusal figures and percentages, allowing for clear KPIs to be followed throughout this dashboard. The flu vaccination dashboard will allow the user to select which CCG area, PCN, network or practice they are most interested in. Other useful filters include gender, ethnicity and housebound status. The Deprivation Filter is another very useful filter to enable the user to select the deprivation scale they would like to consider, 1 being the most deprived 10% and 10 being the least deprived 10%. More details on how deprivation is calculated can be found in the Flu Vaccine User Guide. On the left-hand side we can see a split of each cohort to enable us to understand how many people are eligible based on our current filter selection and how many people have been vaccinated within each cohort. The 2 to 3 year old cohort represents children not at risk and not in any other cohort. The 65 plus cohort represents individuals 65 and over on or before the 31st of March 2021. The 6 months to 64 year olds represent an at-risk patient cohort that can be broken down even further into a number of different conditions. The pregnant cohort can be broken down into a further 3 categories. Care home patients within this cohort may be reflected within another cohort. Patients shown within the carers cohort will not be reflected in any other cohort. This cohort includes patients who are not at risk, subject to vaccine availability. The overall eligibility and vaccinated count will not be reflected in the KPIs at the top of the dashboard. This cohort is available for monitoring purposes only. This section shows how many patients are eligible for the flu vaccination based on your current filter selection. The following section reflects how many patients have been vaccinated within each cohort. The beige bar reflects community pharmacy vaccinations coded into the GP clinical system. The grey bar reflects GP vaccinations. The percentages within the grey bar represent the total vaccination rate of both GP and community pharmacy vaccinations. The vaccine provider filter allows the user to further segment the population based on GP or community pharmacy vaccinations. The grey dotted line shows the total percentage vaccinated plus the contraindications and refusal percentages. The green line represents the 75% target line, which can be altered at the top right. The percentages at the end refers to the percentages of refusals and contraindications within a particular cohort. The right-hand side of the dashboard shows the vaccination rates split by. The view can be changed to see a split by PCN, network, practice, ethnicity, gender, deprivation or first language. This can be further drilled down by using the split by filter. The patient cohort filter allows the user to filter based on the eligible cohorts. The at-risk condition filter is another very useful filter. It only applies to the 6-month to 64-year-old cohort and shows a range of different long-term conditions. The pregnancy subset filter allows the user to segment the pregnancy population by a number of different categories. These 5 filters only affect the bar chart and the figures below. The numbers and the percentages shown below the bar chart are representative of the user's selection within this section. Similarly to the bars on the left-hand side of the dashboard, by hovering over the percentage vaccinated bar, the user can view the vaccinating uptake over time, as well as the vaccination percentage in comparison to last year's. By clicking on the CCG name, or the grey bar, hovering over until the tooltip appears, and selecting Click to Drill Through, users will be redirected to the Drill Through dashboard. The Drill Through dashboard is dependent on your selection made within the 5 filters presented on the right-hand side of the previous flu vaccination dashboard. The Drill Through dashboard shows the current vaccinating uptake over time in comparison to last year's vaccinating uptake. Below this shows the number of patients eligible and vaccinated by age distribution, split by absolute figures and percentages. Users can return to the flu vaccination dashboard here. You can download or print a PDF or CSV Excel document based on your current selection by clicking on the download option on the top right. For step-by-step instructions on how to print, please refer to the WSIC Flu Vaccination User Guide. If you feel this flu vaccination dashboard will help you with effective vaccine delivery and support forward planning within your North West London area, please request access by emailing nwlccgs.wisic.dashboards@nhs.net. Thank you for watching.